start the case, you'll need 4 portals to the shoulder, an anterior portal, a slightly lower anterolateral portal, for which I don't always use a cannula, but I am in this photo, a lateral portal, and a standard posterior portal. I then start with the scope in the posterior portal looking into the glenohumeral joint, and I lance the biceps tendon with a long spinal needle coming through the skin, and I keep the needle directly above the humeral head, which helps prevent retraction when we come through and cut the tendon using arthroscopic scissors. And now I'm looking in the subacromial space through the posterior portal, and I forward flex the arm, and you can see that opens up the anterolateral subacromial space very nicely. I then switch my scope to now looking through the lateral portal. I'm looking down the bicipital groove. You see the biceps tendon is easy to find this location, and I'm pushing up there on the pec tendon using a probe coming through my anterolateral cannula. I then move my probe to my anterior cannula, pull the biceps tendon out of the way, and coming through my anterolateral portal, I start with my guide wire. I usually place the guide wire about 1 centimeter to 1.5 centimeters above the pectoralis tendon. Once the guide wire is down, I then use the drill to drill my pilot hole for the TenoLok device, typically drilling down to 2 centimeters. Once we withdraw the drill, it is now almost time to place the TenoLok device. First, you must score the tendon approximately 2 centimeters above where the TenoLok hole is, because this amount of tendon will be dragged into the hole when we insert the TenoLok device. I now insert the TenoLok device through my anterior lateral portal, and then I come through my anterior portal with the grasper. The grasper grabs the tendon through the loop, pulls the tendon through the loop, and then we slide the suture loop down the tendon towards the area where we previously scored the tendon, where our TenoLok pilot hole was drilled. We then cinch the suture loop down tightly against the tendon and insert the TenoLok device into the pilot hole using gentle taps. Once the device is down, you then turn the dial at the top of the device to deploy the wings of the anchor. The TenoLok device causes both interference fit as well as suture fixation fit, as I do tie knots down on the suture at the end of the case. I then remove the residual stump of proximal tendon by grasping it with a grasper through the anterolateral portal and cutting it from the lateral portal using scissors. Thanks for watching and have fun.